Hello everyone, you are all welcome to lecture number 1216, and today's topic is digital doctor will see you in future, will do diagnosis, and that is doctor AI. And now people have started consulting doctor AI online in Western countries, and it is a big revolution because of two reasons. One is that in 2011, when the deep learning with neural networking and combined with algorithm brought lot of new model and applications, and they were able to collect trillions of data on different diseases, and it was stored. And now with the help of ChatGPT, that is in 2024, Google, Gemini, and recently last week another model or application of AI, that is OpenAI, and it is called Sora and Mora. So all these models and applications, they have made very efficient. Data is very much purified and stored, and lot of information and collection is there. On the basis of that, now there are two types of doctor. One doctor, that is human being, and the other doctor, one doctor that is human, and he has the doctor, human doctor, he has maybe thousands of cases of experience of diagnosis, and the other one is that is doctor AI. And this doctor AI is having trillions of data. Trillions when it can be even 20 trillion, 40 trillion. So if it is the question of diagnosis, definitely the one which is having lot of limitation, that is human being, because of storage of data and experience, solving the problem of a person is very limited. It's not that much smart. But once it comes to doctor AI, which is having neural networking combined with algorithm and ChatGPT plus Google, Gemini, and Sora, it is difficult to imagine how efficient and how smart this doctor AI is. So it has lot of advantage now. The first advantage is that if you are going to any human doctor, you have to sit outside, you have to meet the secretary will see wait, there is long queue, and long queue maybe sometimes if you want appointment, you may get after 1 month, 2 months, especially in Canada, it may go up to 3 months or 6 months. And after that, once you are going to doctor, face to face, human doctor, he is going to ask lot of questions about you, about your symptom, and on that basis, what experience he has, that is the data, is experience, and that on that basis the diagnosis is done. And I am going to give 3 examples here, and I have gone through these research papers. It's a very interesting research paper. One research paper is from USA. One scientist, he trained supervised AI, and on the basis of training, he got the scanning of 1 million eye, retina scanning, and that data is process it is there with AI. So definitely the one which is having 1 million scan data, on that basis, the AI doctor is capable of doing diagnosis perfectly on the basis of AI, the eye scanning of retina. And it is a latest branch according to rare research paper. We know that eye is the most sensitive part of our body. Just like two eye means is camera, it's very sensitive. Photo means light, everything is absorbed, and different type of cells, cones, retina, they are functioning, and blood capillaries are there. On the basis of sugar level or cholesterol or diabetes, your condition of your retina or eye all are changed. So on that basis they are doing diagnosis. The second example I am giving you that is very interesting. I will not give the exact name of the person because it is the secrecy of the case, but it is published in Nature Journal, in American Journal, British Journal. One lady, she got COVID-19 during that time, and after the recovery of COVID-19 viral attack, still she was feeling tired, weak, and she consulted lot of human doctors, up to 50, and that was in Britain and America, in all places. And they were just saying one thing, after going through all the MRI and scanning, X-ray, lot of pathology, biochemical tests, and all doctors were concluding that you have some viral problem. Some virus is there, and because of that viral problem, still you are suffering, because they were linking that because you had COVID-19, that viral attack, and because of that reason, your some of the organs are weak, they are not working properly. So in that case, now finally, what she did, she went to Dr. AI online, and she posted all scan copy, diagnosis, everything to Dr. AI. Within no time, she got the diagnosis. And Dr. AI diagnosed that all what is there, they could not reach to exact point. You have inflammation in your limbic brain. Your brain cells in that particular portion, they are having swelling, that is called inflammation. And you go and take anti-inflammatory specific drug, was prescribed, and after taking that anti-inflammatory drug for 1 month, lady became okay, recovered fully. So this is, very interesting case that human doctors, 50, 60 very experienced consultant, they fail to diagnose. But because of trillions of data, what Dr. AI is having, we cannot compare. We cannot imagine such type of thing. Then the second case was one small boy. He was suffering from hip side, thigh side. It was not possible for him to sit. He was limping, scrolling, was difficult to get up. And the parents, they consulted many doctors, and all of them, after all scan paper and all X-ray, MRI, all images, they diagnosed that it cannot be recovered, it is a nerve problem, and forever he will be limping and he will be like that. That lady went to Dr. AI. After giving all the data, test, scan copy, image, everything, and the diagnosis came that after surgery it can be recovered because there is more spacing in vertebral column, and because of that more spacing, the nerve is not properly capable of passing the electrical signal. So if that space is reduced, he will be fully recovered. And after that, then doctors were approached surgeon, neurosurgeon and orthopedic surgeon, and they reduced the spacing, and that son was fully recovered. Now he is playing and moving. So these examples are latest examples. They are published in research paper, in journals. So in future, there is going to be big revolution in medication, in diagnosis by Dr. AI, and it is my, I can say, I can share my experience after seeing all this. Even my son and doctor, they are also doctors, they are in New York. My advice to every doctor, whether they are in New York or India or Nigeria, please download the Dr. AI software application, keep side by you, and if there is any problem, you do the diagnosis. If suppose you are failing, no harm to go to Dr. AI, because Dr. AI, you cannot compete. It has trillions and trillions of data, purified data, with algorithm, with ChatGPT, with Sora, with neural networking. So it is far, far superior as compared to humans. And every doctor should be ready in future. If it goes like that, it will be the practice of every physician and consultant to keep the Dr. AI side by their table, their software application, so that they can consult. And I am of the opinion that maybe after some 20 years, all the diagnosis people go for Dr. AI, because it is very accurate, precision, and without any doubt, and very, very honest diagnosis is there. So I'm going to show you those two cases. So this is what a research paper I have given the reference, that in America one scientist, on the basis of getting millions of scan copy of eye retina, they are doing the diagnosis, and that scientist has trained the AI with data in millions, and now a lot of diagnosis is done on the basis of the scanning of eye retina. So this is where the picture is very clearly showing that there is spacing in the vertical column between the bone, and that is called spina bifida, and that is because of this problem of spacing, the nerve is disturbed, and that's why the small boy was not capable of walking. This is the image of that small boy, that he was always crawling and it was difficult to get up, and that was because of that particular spacing, and it was diagnosed by Dr. AI, because humans doctors, they failed to diagnose, and they said that forever this boy is going to suffer. This is all different type of retina scan copy. It is given in their research publication that on the basis of different scan image out of MRI or magnetic resonance imaging, the doctor is diagnosing different type of diseases, including Alzheimer's, diabetes, so many other. This is the case of the image, MRI of the limbic brain of the lady who was having the problem of always fatigue and dull, and that's why finally when she failed with lot of consultant, she approached the AI doctor, and in arrow it is showing that there are inflammation, swelling inside the brain of limbic area, and after taking anti-inflammatory drug, she was fully recovered. So the artificial intelligence models, tools, applications were there, and we were not knowing much up to 2010 and 9, because people were not interested and they were not knowing about its a lot of applications. But it started from 2011 when the neural networking, deep learning combined with algorithm and correcting with lot of ratios and maintaining mathematical data, then it became very powerful. So here I have given this number 1. In future, how Dr. AI, artificial intelligence, can change diagnosis and change the medication. Since artificial intelligence boom after 2011, the deep neural network showed such super intelligence that was beyond the imagination of human being, human intelligence. Up to 2010, artificial intelligence applications were not known much to the world. But after the introduction of algorithm, actually algorithm, once it was combined with deep learning and neural networking, then it was explosion of lot of knowledge and lot of learning. So, but after the introduction of algorithm, with the help of deep neural networking combined, we were successful to produce lot of algorithms, and we went on improving day by day. Number 2, today in the year 2024, we have ChatGPT, Google Gemini, Sora, Mora, etc. Many other models are coming, and it has gone to beyond the neural networking, so it has overtaken. And now text is converted into image and video. And that's why it has become more powerful in accurate diagnosis of the diseases, and can go to transfer mode. And transfer mode means different problem can be solved, which is very effective in medical world. Before it was only language, but today it is video model. We are getting all the image and photos. We have lot of image capabilities to understand the problems. Number 3, there is one software which is called Dr. AI. If you go to online, went to Google and type Dr. AI software, you will get. So Dr. AI, go and get help and enjoy the impact of trillions of data, purified data, supervised data for different diseases is there with Dr. AI. And let all doctors prepare themselves to get the help of Dr. AI tool for accurate diagnosis of very complicated health conditions. Please, my humble request to all senior doctors to learn artificial intelligence tools. Still some senior doctors, consultants, they are not having enough time to learn the applications, different tools, different models of artificial intelligence, especially in medication, medical world, which is very, very important today. Because in coming few years' time, every doctor will be having, it will be mandatory to have the Dr. AI software, just to cross check, just to call it second opinion. And this is very, very powerful tool, because you cannot compare. Human doctor is having maybe billions of, not billions, maybe few thousand of cases he has gone through. And the Dr. AI is having 40, 50, 60 trillion cases. They have the data. So there is no comparison. And I have given the 3 examples of that brain, limbic brain inflammation case, and then vertical that is bone spacing, nerve problem, and doctors, human doctors failed, and it was properly diagnosed by Dr. AI. So Dr. AI is already in action. Many people now they have started going once they fail to get proper diagnosis. They go and they are very successful. So with this, I will stop. So in the last but not least, my humble request to all the professional senior consultant doctors in any department, please learn different applications, models and tools of artificial intelligence. It is high time, and I am already of this opinion that in whole of the Nigeria at school level there should be introduction of basic concept of artificial intelligence, new technologies, new applications, new models, day-to-day use of artificial intelligence. Because if we are not going to learn artificial intelligence and we are not going to teach our coming generation, we are making them blind. Because in future, it is having lot of impact in our daily life, not only in the health sector, everywhere, in agriculture, marketing, industries, chemistry, pharmacy, everywhere. So thank you very much for watching the lecture.